When Alberta Chief Medical Officer Dr. Dina Hinshaw changes the rules around COVID-19 in Alberta, she issues a public health order. Now, these are really important because they have the effect of law. They can impose fines, they can be enforced by police. So you expect that, like other legislation, other bylaws, they would be written clearly and so that everybody can understand them, citizens, businesses. Unfortunately, that's not the case. And I'm going to talk to Dr. Lorian Hardcastle, Faculty of Law at the University of Calgary, about one more example of lack of competence in the Alberta Department of Health. So welcome to the interview, Lorian.
Thank you for having me.
Now, like there's just the examples of incompetence are just piling up. And here's another one, public health orders that are poorly written. And that seems like a little thing, but in fact, it's a significant thing, is it not?
Yeah, so the problem is that this is a government that waits until it's almost too late to do something. And then you get in a situation where they have to hastily draft rules that they don't get to the people who are bound by those rules in a timely fashion. And so, for example, Premier Kenney stubbornly refused to implement vaccine passports, even while other provinces were doing it. People were insisting it was necessary. And then when he did, it all of a sudden was a matter of urgency because of the situation in hospitals. And so businesses didn't have time to respond. Some of the statements that were made in the announcement ended up being different in the public health order. And there are still exemption orders that we're waiting for, even though this law comes into effect tomorrow morning.
This is something I've seen on social media, a lot of complaints from businesses who are saying effectively, how am I supposed to enforce this? I don't even know what it means. The rules aren't clear. That seems like it's a disaster waiting to happen.
It's frustrating for business owners, especially those who want to do the right thing and comply and are being forced to pivot to this program. And then some of them are finding out that the rules are different than they thought there were. And that makes it difficult for businesses to comply, difficult for individuals to comply. It makes it difficult to enforce these laws. And ultimately, when the laws are undermined in all of these ways, they're not going to be as effective as they would have been had the laws been more clear.
And I understand that there's a pattern here. This is not the first time this has happened.
That's right. Repeatedly, I and others have called on the government to release these laws in a timely fashion. And the problem, though, is that the government waits till it's so late to act that they make an announcement and all of a sudden the laws are in effect the next day, and those laws are nowhere to be found because some poor civil servant has to draft them overnight. Ideally, what would have happened is what we saw in some other provinces where the vaccine passport was announced in advance of when it was coming into effect so that there could be consultation, businesses could figure things out on their end, and then there's a more smooth phasing in of that program.
Yeah, I guess we should be clear here. It sounds like I'm sort of beating up on government and beating up on those bureaucrats and civil servants. And it's not really their fault. I mean, as you say, if you're expected, you get a call in the evening from the deputy minister who says, "Hey, draft up some rules for a vaccine passport." Chances are, what you turn in the next day is not going to be as thorough and as well written, perhaps, as it should be.
That's right. And the government also sets these rules up to be complex. Instead of having a vaccine passport system that is universally applicable across the province to a certain subset of businesses, instead, what we have here is a program that is optional to opt into. So you need one set of rules for those who opt in, one set of rules for those who opt out. And all of that is so complex. And then, of course, there are exemption orders that one of which has been issued and others we're still waiting for. For example, the exemption order for post-secondary institutions has not been released yet. And of course, classes start tomorrow morning, back up in person.
Right, and there's one today that's that's all the buzz on Twitter, and that is that the PDF document that you actually download can be edited. I mean, you can write anything you want and they can be forged apparently. So we're hearing they can be forged quite easily.
That's right. So not only were the drafters of these rules put under the gun by these changes, but so too were the IT people. The Alberta Health Records System had numerous people reporting that they were 100,000th in line and there were delays of an hour or more. And then the ultimate product that came out of that system is an editable PDF. And there's already a lot of talk online about it being forgeable.
Well, my goodness, just when you think that what more can the Kenney government do, the UCP government do to screw things up in Alberta, where they had 2,000 infections on Friday, and that's forecast to continue going up. And then we hear another story about something that's gone wrong. Thank you very much, Lorian. Really appreciate this.
Thank you for having me.